update of the coronavirus. In China and other countries, there have been an increasing number of cases in health due to the coronavirus COVID-19. What is coronaviruses? Coronaviruses COVID are a large family of virus causes illness ranging from the common cold to more severe disease such as Middle East respiratory syndrome, MERS-CoV, and severe acute respiratory syndrome, SARS-CoV. Coronavirus diseases COVID-19 is a new strain that was discovered in December 2019 and it has not been previously identified in humans. Coronavirus are zoonotic, meaning they are transmitted from animals to people. Detailed investigation found that SARS-CoV was transmitted from bat to human, from severe cat to human, and make cat geometric cat to human. Coronavirus are zoonotic, meaning they are transmitted from between animals to people. Detailed investigation found that COVID was transmitted from civet cat to human, and MERS-CoV from domestic cat camel to human. Several coronavirus are circulating in animals that are not affected in human. Common signs of infection include difficulties of respiratory system, respiratory symptoms, fever, cough, shortness in breath, breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Standard recommendation to prevent respiratory illness such as coughing and sneezing. According to WHO, 6 feet away from human when speaking to them. Avoid crowded areas. Avoid putting your hands in your mouth, nose, or even eyes, which you can easily contact this virus through those ways. Regular hand washing is very important. They discovered that chloroquine has a 10% effect on it, which can reduce it 10%. And they are still working on the vaccine to make sure they get the vaccine that will completely. Number of cases that have been reported. Here you will find information on the virus, on what you have to do to protect yourself. Frequently asked question: what people should know and what action they should take. How can I protect myself from the virus, from the coronavirus? You should believe in the same way you do to protect yourself from a few virus. Regular and thorough hand washing, proper coughing and sneezing, as well as keeping your distance from a sick person. These are the most effective protective measures in everyday life. You should always restrain from shaking hands. How can I protect myself from infection? If possible, avoid going on trip, using public transport, and instead work from home. Generally, all contact with others should be reduced to bare minimum in the attendance of the event. With crowds of people should be avoided. People who are older than 70 years of age should obtain a vaccine against pneumococcal infection. What should be done if a coronavirus infection is suspected? What are the symptoms? Persons who have had personal contact with someone confirmed as carrying SARS-CoV-2 should immediately and irrespective of the symptoms contact their competent health office. Get in touch with the doctors or call your local health center and stay at home. A coronavirus infection causes flu-like symptoms such as dry cough, fever, a runny nose, and fatigue. There has also been reports of difficult breathing and itchy throat, headache, joint pains, nuisance, diarrhea, or shivering. If I have a mild respiratory disease, do I need to go to my doctor practice to pick up a sick leave certificate? Starting immediately, patient with mild respiratory disease of the upper respiratory upper tract can have a certificate or certificate of fitness on work issues for a maximum of 7 days. After consulting with your doctor by phone, there is no need to go to your... In regions where COVID-19 cases has been occurred, should avoid unnecessary contact with others and stay at home. Is there a vaccine? Effort to develop a vaccine are already on the way. As yet, there is no vaccine available, however. And at this time, they discovered that chloroquine has a 10% effect on it, which can reduce it 10%. And they are still working on the vaccine to make sure they get the vaccine that will completely eradicate it. What are the treatment options? Not all diseases that follow a SARS-CoV-19 are required treatment. Even in the most take a serious course and require treatment. Even in the most of the cases reported, disease progression was mild. Treatment of the infection depend on the severity of the disease presentation. Example, administering oxygen, maintaining fluid balance, if necessary, administering antibiotics to combat bacterial co-infection, and also include the treatment of relevant underlying chronic illness. A specific treatment, in other words, one that is directly to the new coronavirus itself, is currently not yet available. How great is the danger that the respiratory disease COVID-19 will now also be spread? Additional cases, infection chains, outbreaks must be expected. Despite the risk, the pathogen is expected to spread worldwide. What should persons do if they fear they might have become infected with the SARS-CoV-2, or if they are returning from the region where there have been an increased number of transmission? Persons who, independently of travel, were in personal contact with someone who has been laboratory confirmed to be carrying the novel SARS, immediately, irrespective of the symptoms, get in touch with the competent health office. The health office will conduct an individual test to assess the specific risk and determine the measure to be taken. This approach also makes it possible to, I repeat, persons who, independently of travel, were in personal contact with someone who has been laboratory confirmed to be carrying the novel SARS-CoV-2 virus should immediately, irrespective of the symptom, get in touch with the competent health office. The health office will conduct an individual interview to assess the specific risk and determine the measure to be taken. This approach also makes it possible to coordinate medical attention should any symptom emerge. People who have spent time in a risk area as identified should irrespective of symptoms avoid unnecessary contact with other people and stay at home. Wherever possible, should you experience acute respiratory symptoms, you will need to follow proper coughing and sneezing etiquette as well as proper hygiene and see a doctor, making sure you have called ahead to announce your visit and provide information regarding the places you visited. If you're traveling from a region where cases of COVID-19 have occurred, but it is not deemed a risk area. You should visit a doctor after announcing your visit ahead of time by telephone by saying that you have been traveling. If you develop symptoms such as fever, coughing, or difficult breathing, 14 days of your trip, within 14 days of returning from your trip. In addition, you should avoid unnecessary contact with other people. Stay at home wherever possible and follow proper coughing and sneezing etiquette as well as proper hand hygiene. Is there a danger that a person can become infected with the novel coronavirus SARS-CoV-2 through imported foodstuffs, surfaces, or objects? In the case of coronaviruses, they are capable of causing respiratory diseases. Vaccination primarily takes place through secretion from the respiratory tract. If your hand then come in contact with these infectious secretions and you subsequently touch your face, for example, infection could occur by this means. This is why proper hand hygiene is important. Where numerous other infections such as gastroenteritis that artists may not responsible for the assessment of foodstuffs or objects. When was the first information about the outbreak received? On 31 December 2019, China WHO country office was informed of a cluster patient with pneumonia of pneumococcal in Wuhan, a city of 90 million inhabitants in the province of Hubei, China. When did the outbreak start? According to the information from the Chinese authority in Wuhan, some patients worked as traders and vendors at the trader of Wuhan seafood market in Wuhan. It is the largest seafood in Wuhan. Some patients work as traders or vendors at the Wuhan seafood in market Wuhan. It is the largest seafood market in Wuhan with over 600 stores and 1,500 workers. It has been reported that the wild animals and all organs of other animals and reptiles are also offered for sale at the market. It is currently assumed that SARS-CoV-2 was spread to human beings from bats. Has there been similar outbreak in the past? This new virus is a pathogen belonging to the coronavirus family, which is the same family as SARS, severe acute respiratory syndrome, and MERS-CoV, Middle East respiratory syndrome coronavirus. In 2003,